Mr. Fountain, what's going on?
for the tiled view. Hmm. Yeah, they did update. Google did update the Meet application, and it does have tiled view if you go look into settings. Um, I'm not sure. Yeah, for Chrome. If you go to change layout, you should see tiled as an option there as well. Uh, yeah. So, but I don't know if it would interfere with your extension. Sure, you're welcome. All right, Tony, we're live, so y'all can take it away whenever you're ready.
authorizing our interim executive director to enter into an agreement with Safety Environmental Laboratory Consultants Incorporated for lead-based paint testing and to rescind previous approval, which was given at the April board meeting. HHA is the recipient of a lead-based paint grant made available through HUD. In April, the board did approve a contract with GLE Associates. Before we were able to execute that contract, GLE changed their pricing, and their pricing was far too high, and it was also submitted outside of the time when changes to their proposal could be made. So they decided to remove their proposal from consideration, and the remaining 3 proposers were reevaluated. Safety Environmental Lab Consultants came in as the highest ranked proposer, and I've got the chart listed in your documents for your reference. And this contract will be in an amount of $238,700, and these funds will be paid from our 2019 lead-based paint capital fund grant. Again, this is a request to authorize a contract for lead-based paint testing and a risk report, and this is action 2020-22. Are there any questions about this action?
Okay, just for the record, we usually say this every board meeting. I want to make sure I don't forget to say this, but this is not the first time that the commissioners have had a chance to look at these resolutions in detail. So while it seems like we may be moving judiciously through these, please understand that each commissioner has had a chance to look at this information beforehand in detail as well too. So I just want to make sure that be known for the record. With that being said, there's a motion on the floor for Resolution 2020-22, and that resolution to an agreement authorizing the executive director to enter into agreement with Safety Environmental Laboratories for the performance of lead-based testing and rescinding a previous approval to enter into an agreement with GLE Associates. Do I have a motion?
Move for approval of the resolution as presented.
Commissioner Fountain moved. Is there a second?
Second.
Commissioner Bolte, second. Anyone have any other questions for Keisha?
Keisha, may I ask, I think you answered it previously, but the $238,700 contract, is that the amount of the capital fund grant, or is the grant greater than that amount?
Yes, so the capital fund grant is for $1 million. So this is below the total amount of that grant.
So we can still use that grant if needed for other needs.
So once we receive the report, if we find any lead-based paint, then we can use those funds to abate those issues. And once we abate them, then we can further use the funds to do more testing to confirm that the abatement is successful.
Okay, perfect. Thank you.
You're welcome.
Any other questions pertaining to the resolution or the motion? Hearing none, all those in favor say aye.
Aye.
All those opposed, nay. Hearing none, the motion and resolution passes.
Thank you.
All right, thank you, Keisha. Danielle has housing operations. Danielle.
Good afternoon, everyone. Thank you. I only have one item to present today, which is the resolution authorizing the interim executive director to purchase temperature screening systems for the authority. Due to the COVID-19 pandemic, HUD had issued a great deal of CARES Act funds to the Housing Authority, both public housing and the Section 8 department, to allow the Housing Authority to take actions needed to prevent the spread of COVID-19, to respond to COVID-19, and to assist our residents in dealing with the challenges of the COVID-19 pandemic. Therefore, in May 2020, knowing that we had those funds, the Huntsville Housing Authority requested some cost proposals for temperature screening kiosks systems to be used in public housing offices, the central office, and our community buildings. These kiosks are needed to protect the health of our assisted families and our staff from COVID-19. And the kiosk will alert HHA staff to persons entering an office or space with an elevated body temperature, which could indicate infection with COVID-19. Of course, it's not just limited to COVID-19. They can also be used, I mean, if anyone has an elevated temperature, perhaps during flu season or so forth, they still would have applicability after the, or hopefully after the COVID-19 pandemic is behind us. Again, the objective was to minimize the risk of exposure to COVID-19 to our families and our staff. And so we sought the purchase of a total of 14 temperature screening systems with the locations listed in your board packet documents. All of the public housing sites, as you can see, along with the central office lobby, the resident service building, the one-stop shop, the Boys and Girls Club at Sparkman Homes, and a spare in case we find another location or for some reason one of the systems becomes defunct or is unable to be used at a certain point in time. We received, our procurement officer reached out to 3 different companies and received responses, as you can see in your packet, from Wello, Olio, and Meridian, each of them having varying levels of IT requirements and other kinds of amenities. We wanted something that we could deploy relatively quickly that did not necessarily require a lot of IT involvement, knowing that our IT administrator already has a great deal of responsibilities along with the conversion. So we wanted something that we could purchase, that we could deploy pretty quickly without having to add additional burden. To that end, Olio was deemed the most responsive proposer in terms of cost and the ability to deploy quickly. The cost of the temperature screening system should not exceed $41,642. I will correct that in the document. This will be paid for out of CARES Act funds that the HHA received from HUD for purchases related to COVID-19. Included with your documents, you should see the specifications for the Olio temperature screening system on the following pages, along with the quote or the pricing quote from Olio or Olia, and the slim footprint, all the other descriptors about the specifications are located in your board packet. So that is, are there any questions before I proceed? I know it's a bit of a technical apparatus, and so are there any questions about this before I proceed?
Danielle, question here. So what is the time frame from the time that this board may potentially approve this and we enter into the contract to where they will actually be on site?
Their expectation is anywhere without any unforeseen circumstances between 6 to 8 weeks.
Wow, that's a little bit of time.
Yes, yes, it is, and so that's one of the reasons why we don't want to wait on it too long, because and that's for anyone that we've been reaching out to in terms of what the time would take in order to get these on board. I mean, there's such a demand, they can't even keep up. But it does take time to put these together, especially this many screening systems. It does take time to get that package shipped, get all the materials in and sent to us.
Yeah. Okay. Anyone have any other questions for Danielle?
Yeah, this is Jim. Thanks, Danielle, for the explanation. I
Yes, sir.
kind of referred to this in our preliminary meeting that Dr. Smith referenced earlier, but this $41,600 is basically just for the hardware and maybe software that comes along with it.
Yes, it
What
does.
happens if somebody comes up to the kiosk and they have an elevated temperature, but they still want to come in?
So at that time, so for example, at our central office, we do have a security guard who would alert them and say, as discreetly, of course, as possible. This time, due to their elevated level, they are or elevated temperature, it may not be the safest for them to come in at that time. Is there a way that they can be reached else otherwise by phone? Can they have a virtual meeting? If there's something that they need to leave, we do have a Dropbox where they can leave documents at the central office. We do have Dropboxes also at our sites, so it would be so they could still have their appointment if they needed to, but they might need to have that virtually or remotely. They could still leave documents if they wanted to, but we would inform them that it's not, that their health is important to us, the health of other residents, and of course the staff. So it may be best to either hold the meeting virtually or postpone it if they really need to hold it in person once their temperature level has come down.
But what about the other 12 or 13 sites?
So at the property management level, so the property manager would have that conversation, or the assistant property manager would have that similar conversation with the resident who's coming in to say, again, we understand, but if you could please leave your items in the Dropbox, or we can have this conversation over the phone. It's just that, we want to make sure that, you're not endangered, that other residents and staff aren't in that is our nation at this time. Hopefully folks would be understanding as when the property manager makes that point to them, that we're not trying to not meet with them or meet their concern. We may need to meet it in a different manner at this time. Again, by phone, by virtual, other ways, or we could postpone it until their fever comes down or their elevated temperature comes down. Excuse me. The community offices, the resident services, we do have staff there at either location where, again, staff could have that conversation with a resident or visitor who's looking to come in. At the one-stop shop, we would inform our partners that are there. Community Action and Community Action has their own entrance, and Partnership for a Drug-Free Community, they're at the main entrance as well. So we would educate them and inform that we're putting this in place, and that folks with elevated levels elevated temperatures should be discreetly told that perhaps they could reschedule their meeting or hold it virtually.
Okay, thank you. It's, we're approving the spending of this money for the hardware, but as I'm trying to allude, there's some operational aspects of how we're going to deal with it should it occur.
Yes, sir.
It's the exceptions that matter, not the normal processing. So just think about that. And I think Tony commented on it in the preliminary meeting that, that we're going to try to use some security personnel if needed. So, somebody just may say, I feel fine, I want to come in, and we're going to say no. We also want to protect the property managers. They shouldn't have to interface with them face to face if somebody's got an elevated temperature. Okay, thank you, Daniel.
So this is Dale here. So I know I was not at the preliminary meeting, and please forgive me if this was brought up, but have we also looked into the potential of doing like a handheld, temperature device as well too? Because they're running about $60 to $100, not as a substitute for this, but just thinking about the amount of time and thinking about the cases in Alabama and the wave that's here, second wave, if you want to call it that. Have we looked into that as another option as well?
Yes, sir. We have already made those purchases.
Okay.
So we do have them so that, to your point, that we're not waiting 6 to 8 weeks to only then receive some temperature screening apparatus. We already have those in place. We received those, today's the 15th, maybe about 2 weeks ago. So
Okay.
those have been out at being used at central office and at the sites as well.
And do you recall, to Commissioner Bolte's point, any situations where someone had an elevated temperature and they had to be asked to come back at another time?
Oh, well, offices at this time aren't open to the public from the public housing standpoint. So folks are having their meetings again by phone or are dropping things off. No one has tried to enter the offices because we have notices up that we are closed at this time. But to your point,
Great.
that might be a question that will come up once we do reopen fully.
Yeah. Well, this is definitely going to be the new norm. I know at the institution work, Alabama A&M University, we are putting them in every building as well too. And so, to Commissioner Bolte's standpoint, I don't know what our procedure is for any of our 6,000 students walking around that's trying to get access to a building that have elevated temperature. And so, I wouldn't want to be the one charged with telling them they can't come in to take an exam, but they may want that. They may be wishing for elevated temperature so they don't have to take an exam. But okay.
One thing I will say is that what I'm very glad about is that our residents have been very, very responsive and helpful during this time when it comes to working with the managers. They've been very understanding, and they know that the reason we're taking these steps is as much for their health and well-being as it is for that of the staff as well. And so we have not had any, sort of irate residents banging on doors trying to get in or so forth. They've been really understanding and our partners throughout this process. So my hope, my expectation is with the relationships that our managers have with our residents, that same level of engagement will continue. But again, there could be those offshoots of that, that one time where someone's really upset, and we will have to develop some procedures to deal with that. You're absolutely right. Whether that's security or some other means, we will need to make that plain very shortly. Yes, sir. So this is the resolution presented before you. Again, I do need to make that correction in the RBA. Those numbers were transposed. It should be $41,642 in terms of the economic impact, and those will be paid for out of the CARES Act funds that we have received from HUD for purchases related to COVID-19. And this is resolution 2020-23, where the recommendation, of course, is that the executive director be authorized to enter into an agreement and to purchase 14 screening systems for HHA from excuse me.
Thank you, Danielle. So we have
Thank you.
a potential motion on the floor for resolution 2020-23 for the purchasing after screening systems. Do I have a motion?
A motion to approve as presented
Okay.
with the corrections she mentioned.
All right, Commissioner Bolte moved to approve with the correction. Do I have a second?
Second.
All right, Commissioner Fountain, second. Any other questions? Danielle's done a great job of explaining this. We've asked for questions, but any additional questions? All right, if not, all those in favor, say aye.
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 All opposed? Hearing none, the motion passes.
Thank you so much.
All right, thank you, Danielle. And next we have assisted housing. Paula, are you still there?
I am. I have, good afternoon. I have one item, and that is asking your approval of a revision to the admin plan for the Section 8 Housing Choice Voucher Program. You previously approved revisions to the admin plan concerning the waiting list and the preferences last month or maybe the month before, but we have now, this revision is to assign points to the preferences, so they'll be weighted. I attached the actual revision to the plan in your board packet, and we assigned points, especially so that we could select people for the mainstream vouchers, which we just received. They'll be effective July 1st. And we received 50 and we were awarded an additional 15. So now we have 65 mainstream vouchers for non-elderly disabled families. And we gave a preference to those families that are currently homeless. So if they live in Madison County and they have a non-elderly disabled household member and they are currently homeless, they receive the maximum number of points. Now, these other ones that you see at the top, the 2 criteria for the 30 points, that's a HUD requirement that we have that in place just in case our funding gets cut and we have to take vouchers back. Obviously, when we get the money, we would go back and reissue those families whose vouchers were taken away from them. So that hasn't happened. We don't expect that to happen. So the maximum number of points at this in time would be for the mainstream voucher families, and that's what we were trying to put in place by adding these preferences to our plan. The preference point system was put in place effective June 1st, and because of the COVID waivers, we were allowed to do that and bring this to you at a later date. We actually had until the end of July to bring it to the board, but go ahead and do it now, but we did put it in place effective June 1st. Anyone have any questions for me?
All right, hearing no questions at this time, we have a resolution 2020-24 that's been presented to this commission for approving the revision to the Housing Choice Voucher Program Administrative Plan. Do I have a motion to, do I have a motion?
Move for approval.
Commissioner Fountain, moved. Do I have a second?
Second.
Commissioner Bolte seconded. Any further questions or discussions pertaining to this revision? Hearing none, all those in favor say aye.
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 Opposed? Hearing none, motion passes. Thank you.
Thank you. Thanks.
Thanks, Paula. And last but not least, Ms. Jones. Ms. Jones? Ms. Jones.
You see a picture of her.
Yeah.
I'm headed down there. Let me see if I can help her out.
Okay. Director McGinnis, if Ms. Jones can't come on, can you lead us through the resolution?
Yes.
Okay, we'll give her a little bit of time.
All right.
There she is.
Okay, thank you. Neil brought me another computer. Can you hear us now? Okay, thank you
We
so
can hear
much.
you
And I'm
and see you.
sorry. Okay, the item is a request to act on resolutions for approval to amend Huntsville Housing Authority's Personnel Policy Manual, revising policy number E14, social media, has been reviewed by our legal counsel, Walter Kelly. In the revised policy, strike-throughs indicate what was deleted, and highlighting indicates the items that were added. Huntsville Housing Authority's Personnel Policy Manual needs to be amended to reflect the revisions in social media. Among the revisions, the policy distinguishes between official HHA social media accounts and employees' personal social media accounts. It also clarifies that any access to HHA social media accounts must be granted by the executive director, CEO, or his/her designee. The purpose of this request is to obtain board approval to amend HHA's Personnel Policy Manual, revising policy number E14. Huntsville Housing Authority realizes that employees approve employees. This policy established the guidelines for social media uses at HHA. Alternatives. So therefore, the recommendation is that the interim executive director, CEO, amendment to HHA's Personnel Policy Manual, revising policy number E14, social media, be adopted. So we are presenting resolution 2020- Are there any questions?
Come in reference to the approval to amend the Housing Authority's Personnel Policy Manual, number E14, as it relates to social media. Is there a motion?
Yeah, Carol, I just want to say thank you anyway, but I'll move to approve this as presented by HR. Thank you.
Second? Commissioner Fountain, thank you for that second. Any other questions for Ms. Jones in reference to this policy? Okay, hearing none, all those in favor for approving this resolution, please say aye.
Aye.
All those opposed, nay. All right, the motion passes. Thank you. I think that's the last of the agenda items at this point in time. Do we have a report from you, Director McGinnis?
I just want to talk briefly about a couple of things. One, I want to kind of go back to the security issue and the scanning devices. When back, I think it was back when I first came back to the housing authority, we had a situation with an irate potential customer who came and was being very disgruntled with one of our intake specialists. And at the time, you know, we really were searching to put something in place to keep everybody safe. One of the things that we decided to do